Yes, madam.
Yes, madam.
I have uploaded these sessions yesterday. Did you read out those or not yet? Anyhow, I am going to discuss with you 3 sessions today. These 3 sessions are not going to assess you at the coming NVT1, but these sessions are including in your course. The 3 sessions today I am going to discuss with you is the session 11, understanding genetics and genomics in nursing. It is a new field to nursing actually. As a trends and issues in nursing, I hope to introduce you these new pathways in nursing. Then next session is incivility in nursing. The next one is incivility in nursing, and third one is nurse navigator role. The 3 sessions are new topics in nursing field, so that we will try to complete those sessions in this 1 hour period, because in our view as a university, we are not assuming that everything in a session should be described to you, but I am going to discuss with the important points. If you have any questions, you can query with me, but anyhow, I will explain to you the key characters of the sessions. Not going to discuss with every word in the session. Okay. Then these are the includings in this session: introduction to genetics and genomics in nursing, definitions and descriptions of genetics and genomics, definitions for genetics and genomics, then essential attributes of the topic, then nurse genetic professionals. There are professional nurses called as genetic professionals. Then role of that general nurse in the genomics care. Then the effect of current investigation practices on the field, performing the nursing assessment, genetic counseling and evaluation services, the future of genetics and genomics in the world, like that. Actually, most of the time you may have not hear, sometimes not hear this topic, that you know what is genetics, but what is genomics care. That there are nurses in the world that caring genetical issues of their clients. That is included not regarding the bodily makeup, but the environment and society and other factors related to genetic called as genomics care. Okay, shall we go to the session? Then you have to switch off your from the, if not it is disturbing to all of us. Then introduction to genomics and genomics. You have to read out. If you have not read, try to read out this immediately when I am discussing with you. The field of medical genetics and genomics possesses a history of almost a century of time. Genomics and genetics and genomics කියන එක not a new topic actually. It's having 100 years of history. The initial theory was founded by Gregor Mendel as the bioscience student at the A level. Sometimes you may have heard about Mendel. Mendel theories learned. The Mendel is the scientist who did experiments regarding this genetics using the pea plants. Then along with that rules regarding the heredity was established. මේ genetically makeup එක ගැන ඊට පස්සේ තමයි how ගැන බෝංචි පෙළ ගැන මෙන්ඩල් ගෙනියන තියෙනවා. You may have learning at your A levels. Okay. But you are many newcomers are disturbing with the noises. Actually, your time is going with that disturbances. Then people are having many genetic disorders presently and previously also chromosomal abnormalities are there. Then sometimes some hereditary diseases. Actually, they are most probably in these days diabetes mellitus also a hereditary makeup. That means multifactorial effect is there. Then cancers, cardiovascular disorders, autoimmune disorders, and muscle dystrophy disorders, like that. Many disorders having genetical link. Then actually this nursing category should assess and give the essential service to this category of people. Then definitions and descriptions of genetics and genomics. Then you should know what is gene. I think no need to explain its basic physical and functional unit of heredity. What is genetics? That is study individual genes and their impact on relative what is genomics? Then study of all genes in a human structure, together including their interactions with each other and the environment and the influence of other psychosocial and cultural factors. It is a holistic approach for genetical diseases called as genomics. Okay. Then what is pedigree? These key terms I am introducing to you. It is the graphical illustration of the family health history using standard symbols. කියන එකේ heredity factors එක graphical illustration එකක් තියෙන එක family health සම්බන්ධව. What is pharmacogenomics? The study of how genes affect a person's response to drugs. This relatively new field combines pharmacology. You may all know that each and every person is not same for a same drug reactions, and sometimes you may know that some people are getting some drugs, one tablet for a hypertension. Sometimes it is not useful for another person. His hypertension is unable to mitigate with that drug. That means we are responding for say, different drugs differently. That means we should assess it. That is called as pharmacogenomics. Then definition of genetics and genomics nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis of human response, and advocacy in the care of the genetics and genomics, health of individuals, families, communities, and populations. In simply, the genomics nursing is called as protection, promotion, and optimization of health abilities or health prevention of an individual person who are suffering through the diagnosis of human response to any genetical diseases. This includes health issues, genetic conditions and diseases or susceptibilities to disease caused to influence by genes in interaction with other risk factors that may require nursing care. Nursing care අවශ්‍ය වෙන other risk factors තියෙනවා genetically link එකක් තියෙන. Those things should address in genomics nursing. Actually, genetics and genomics in nursing basically involves with the evidence-based practice. We have discussed last day school regarding the evidence-based practice that in this genomics care also need that EBP. Genetic conditions could be varied such as anomalies, behavioral changes, diseases, issues of predispositions caused by genes. These issues we should address as a genomics nurse. These may significantly affect one person's health or abilities. Most importantly, these diversions may be heritable or non-heritable. The genetic nurse can provide her service to several different occasions, such as these are the occasions people who are living in any stage of life, suffering from genetic disease. People who are suffering from a disease has a genetic component. Patients or couples having a risk of getting an offspring with genetic condition. එකක් ඉන්නවා නම් community ඒගොල්ලන්ට උදාහරණයක් විදිහට අපි ශ්‍රී ලංකන් එක්සැම්පල් එකක් ගත්තොත් සමහරවිට තැලසීමික් දැන් රිස්ක් එකක් තියෙනවා නම් තැලසීමික් බබෙක් ලැබෙන්න එතකොට යාට අර ජිනෝමික්ස් නර්ස් කෙනෙක් is for that situation, how to tackle that, how to get that instruction like that. People who are requesting genetic information. Then essential attributes of genetics or genomics. Nursing is a new area that is being establishing in the health sector. Then numerous theories collaborated to develop this field of nursing, including genetic assessment, diagnosis, planning, implementation, and evaluation. The above factors depend and happen according to the following attributes. Then nurses has to pay attention for patients or clients who have been terminally experiencing or just diagnosed with genetic disorders. Then knowledge related to genetic be utilized in process of nursing care. These are essential attributes. Ability to integrate the objective data with the subjective data, which may gain with the possession of risk to genetic condition or chronic disease. A caring nature that elicit a good relationship between nurse and the client, benefit health healing. Nurse genetic, there are professional nurses in genomics care. Many
Excuse me, madam.
different rules and regulations when a nurse is going to specialize to genetic nurse. Actually, unfortunately in Sri Lanka has not yet been improved that far to manipulate a genetic nurse specialist. Then Sri Lanka තාම එහෙම genetic nurse specialist කෙනෙක් use කරන්න තාම කිසිම සිතුවිල්ලක් නැහැ, but worldwide is using.
Excuse me, madam.
Yes.
Madam, may disturb me.
මොකද්ද කරන්නේ? දැන් මම මේ සැරින් සැරේ මම මියුට් ඕන් කරනවා. මේ ඉතින් මට තප්පරෙන් තප්පරට දැන් ඒක දැන් මේ පස්සේ ජොයින් වෙන අයට තමයි දැන් ඕගොල්ලෝ දැන් මම ඔයගොල්ලන්ව මියුට් ඕල් කරනවා. ඊට පස්සේ මේ ජොයින් වෙන අය ආපහු මේ ওই විදිහට ඒගොල්ලන්ගේ අර ඔෆ් කරගන්නේ නැහැ. I can't manipulate it. Very disturbing to all. It is individual's responsibility for not disturbing others. දැන් මම දැන් මේ වෙලාවේ මියුට් ඕල් කරනවා ඔක්කොම කරලා කරගෙන යනකොට ඔන්න පහුවෙලා මේ ඇටෙන්ඩ් වෙනවා කවුරු හරි. එතකොට එයාගෙන් තමයි ඩිස්ටර්බ් එක එන්නේ. Can you? Yes. Then the conditions other countries as a bit different. Consider USA as an example. The registered nurse in USA has to follow some procedures to gain the title as a genetic nurse. Like there are two titles as advanced practice nurse in genetics, APNG, and genetic clinical nurse. USA වල තියෙනවා two titles for genetic nurses, then advanced practice nurse in genetics and genetic clinical nurse. In USA, to become an advanced practice nurse, the nurse should be registered nurse who has been fully practiced for 2 years and should possess a master degree in nursing from an accredited university program. Originally, there should be 30 educational hours and 1,500 මට ඉන්ෆෝම් කරේ නෑ ටයිම් ටේබල් එකේ තිබුණේ
මම ඉස්සෙල්ලා මේවා කරා ඉතින්
ඔව් මම හරියටම 10ට ආවා
ඔව් මෙයා මෙසේජ් කරලා තියෙනවා
ඔව්
කවන්න
කරන්න නෑ මම 12 දැන් ආයෙ මාරු 12 වෙනවා හරි sorry then originally there should be 30 educational hours with practical hours in this specialty area of nursing. These are the qualifications. To become a clinical genetic nurse is to great challenge. USA is not providing new certification as genetic clinical nurse, yet it provides recertification evaluation of the performance. Actually, the heart is being clinical genetic mass. Then role of the general nurse in the genomic care. It is very hard to find many nurses throughout the world who have been qualified genetically and genomically specialized in the world. Yet there are plenty of general nurses who deals with patients and healthy people. Actually, this specialty area is not popular yet with the practicing nurses, but there is a demand for this field, but general nurses are practicing with this type of patients. General tends to have more opportunity to maintain good relationship with patients rather than other health professionals. Nurse can get a lot of information regarding the family history while performing general assessment of the patient. At this point, we are discussing regarding role of the general nurse in genomic care. At this point, if the nurse come up with an information that would bring up the red flag for the patient, probably a warning, a suspicion of having a genetic disease like cancer, she should immediately take an action for that. The couple do not experience may having you when you are getting the history of the patients. There are some patients with relatives is having their mother or sister or having history of breast cancer. Getting more than 50% risk to get an breast cancer. Then like that, when you get alarmed with that, you have to study further that patient. General nurse can guide the patient to correct destination, situation and the disease. දැන් ඒ වගේ nurse කෙනෙක් ඔයගොල්ලන්ට හම්බ වුණොත් your responsibility as a nurse without having genetic in the field, you should do your part. That means you should, that patient may came for another disease, but you should educate them regarding genetical predisposition to any disease condition, and it is your responsibility to educate them regarding that genomics care. Then providing reliable, accurate information, ensuring the most appropriate referral. කාටද හරිම referral එක කරන්න ඕනේ, කාලඟටද යන්න කියලා කියන්නේ. දැන් අපිට එයාගේ history එකත් එක්ක අපි කියමුකෝ gastrointestinal cancer එකක history එකක් කියලා එන්නේ. එතකොට ඔයගොල්ලෝ gastroenterologist කෙනෙක් ළඟට හරි ඒ සම්බන්ධ oncologist කෙනෙක් ළඟට හරි refer කරන්න. Being the advocate for the patient, maintaining the confidentiality is maintaining confidentiality is a very necessary thing at this genomics care. මොකද උදාහරණයක් විදිහට ඉතාලම කෙටියෙන් කිව්ව patient කෙනෙකුගේ genetical history එක මොන දෙන්න වෙන්න පුළුවන්. Then providing reliable, accurate information. Along with the nurse-patient relationship, patient may tend to ask several questions regarding disease condition. Each attempt, nurse should provide the accurate information. Make the patient remind to inform the physician regarding the disease conditions exist among the patient's family members. Nurse can also support the patient by providing information on reliable educational sources where he or she can learn about the disease condition. දැන් මේ වගේ ඔයගොල්ලෝ ජෙනරල් නර්ස් කෙනෙක් විදිහට ප්‍රැක්ටිස් කරද්දී මේ වගේ ජෙනෙටික්ස් ඇන්ඩ් ජිනෝමික්ස් කෙයා එකක් නීඩ් client කෙනෙක් ඔයගොල්ලන්ගේ caring context එකට ආවොත් එතකොට ඔයගොල්ලෝ කරන්න ඕනේ ඒවා මොනවද? confidentially ඒගොල්ලන්ගේ තොර information maintain කරන්න ඕනේ, අවශ්‍ය තැනට refer කරන්න ඕනේ. ඒ වගේම ඒගොල්ලන්ටත් ඒත්තු ගන්නන්න ඕනේ ඒගොල්ලන්ගේ pedigree එක. ඒ කියන්නේ health history එක ඒගොල්ලෝ දැන් අපි යොමු කරන තැනටත් expose කරන්න ඕනේ. ඒවා හංගගෙන ඉන්නේ නැතුව දැන් සමහර අපේ ශ්‍රී ලංකන් context එකේ cultural settings වල කැන්සර් එකක් තියෙනවා කියන එක කියන්න මිනිස්සු කැමති නැහැ. සමහරට අම්මට කැන්සර් එකක් තිබුණා කියලා කියන්නේ නැහැ. අක්කට නෑදෑයෙකුට තිබුණා කියලා කියන තමන්ට තිබුණත් කියන්නේ නැහැ සමහරට. එතකොට ඒ වගේ ඒවා අපි එඩියුකේට් කරන්න ඕනේ. නමුත් අපි මොකක් හරි disease condition එකකට අපි කවුරු හරි තැනකට යනවා නම් ඒවා ඒගොල්ලෝ කියන්න ඕනේ බව ඒගොල්ලන් දැනුවත් කිරීම genomics nurse කෙනෙකුගේ responsibility එකේ purview එකට තමයි වැටෙන්නේ. Then you should ensure the most appropriate referral should be the advocate for patient. Simply, this is the being advocate means simply this is the way that nurse guide the patient. Nurse has to be certain that the nurse and the client receive the accurate genetic information. There should be a perfect communication in between nurse and the patient who are giving and receiving information. It is important to determine the comprehension and cognitive ability of the patient. Being an advocate reflects a large responsibility. The nurse has to be there for the patient. Suppose if the patient is having a discussion with the genetic professional, the nurse has to keep asking the patient whether the patient understood the points that has been discussed with the genetic professional. Then advocate nurse කෙනෙක් advocate වෙනවා කියන්නේ දැන් patient අපි refer කරා කියමුකෝ genetical professional genetics professional කෙනෙක් ළඟට. එතකොට එයාත් එක්ක කතා කරනකොට ඒ අවශ්‍ය information patient ගෙන් ලැබෙනවද කියන එකට අපි assurance එකක් තියාගන්නවා. Maintaining the confidentiality is extremely important in this genetic field. Revealing of serious genetic conditions can affect patient and his or her family members as well. The conversation and the discussion regarding the effect of current investigation the genetics and genomics in nursing. As nurses, you must have an idea about the prevailing status of genetics and genomics. We have discussed now. One of the biggest benchmark happened in the genetics and genomics in the world is known as the Human Genome Project. It was initiated in 1998 and ended 2003 by sequencing the human genome. This investigation has led the direction of science to direction. Earlier, the scientists have thought that human genome is composed of 80,000 to 100,000 140,000 genes. But according to the Human Genome Project investigations, it is revealed that human genome is composed of around 30,000 genes, and only 2% of them are responsible for the coding of the proteins, and only 50% of the genes are considered to be causing for the repeat sequencing of proteins, known as the junk DNA. Most importantly, the new knowledge will be fruitful only if they use it for the practice. In other countries, genetics and genomics have been started to taught as a separate subject. Students are more directed towards research. They are also encouraged to literature surveying that would enhance the current knowledge. How can nurse improve the practice and knowledge on this field? The nurse have to involve in several activities to update their knowledge on this field. It should be a lifelong learning process. Nurses have to attend to conference webinars. Moreover, if possible, they can do literature serving as mentor previously. Then we should discuss that what is genetic testing. I assume that you can hear me. Is it okay? Students?
Okay, madam.
Can't you hear me? Hello? Hello?
Hello, madam.
Can you hear me
Yes, madam. Yes.
steadily?
Yeah. We can hear you.
Yes, madam. Yes.
Voice breaks, isn't it?
Sometimes there has some break.
If you can't hear, you have to give me an alarm like that. Send me a message or something, okay? Then what is genetic testing? Genetics testing targets on individuals who are predisposed to specific gender. As we discussed, some people are genetically predisposition to some diseases. Then these tests should be done for evaluating them. This will provide information to arrive to a proper diagnosis of inherited conditions with non-genetic involvement. Genetic testing can be conducted in either genotype methods, which involves the analysis of chromosomes and genes directly using these are actually very expensive diagnostic test. The countries like Sri Lanka cannot afford for every patient, but you know that some points like anomaly scans and at a pregnancy, sometimes at the 20 weeks, it is in government hospitals also doing it, I think, as a permanent testing. Then, if there is a genetically predisposed patients, we have to arrange it for them. Then, for the local purchasing prices also. Then, genetic testing can be conducted either directly using in-loss the analysis of chromosomes and genes, directly using very identical laboratory technique to identify any specific disease condition related to genetic alteraction presence. Basically, this may be chromosomal DNA based or biochemical. We have mentioned here example test for current usage. The genetics testing can be utilized in many stages of a person's life. It could be parent, prenatal, pediatric or adult stage. Then in this table, we have mentioned the purpose of genetic testing and type of genetic test. Then carrier testing, cystic fibrosis, sickle cell anemia, thalassemia, like that. DNA analysis, hexoamine activity testing and DNA analysis. Then prenatal diagnosis, amniocentesis is often performed within the research for a chromosomal or genetic abnormality. Actually, in the Sri Lankan context, we are doing genetic test, but if we identified some malformed the embryos, but there is no law to terminate them. Lanka, I think anomaly testing karata anomaly තියන embryo එකක් identify කරගත්තා ශ්‍රී ලංකන් law එකට අනුව අපිට ඒවා therapeutic abortions වලට යන්න තියෙන therapeutic abortion එකකට යන්න පුළුවන් සමහර situations තියෙනවා but the abortion is not legalized in the country yet. Then these tests risk for the open neutral tube defect. Like that, there are many genetical testings and you can read out those type of the genetic test. Then what is genetic screening? Genetic screening කියන්නේ මොකක්ද? This differs from genetic testing from the amount of people involved. Genetic screening is testing of population. මොකක් හරි ඔයගොල්ලෝ screening test කියන එක දන්නවනේ. ඔයගොල්ලෝ දන්නවා public sector එකේ, that means the public health වල යම් සමහර disease conditions වලට screening කරනවා. Like that, genetic screening means the population are screened for some genetical diseases and predispositions. With the genetic screening, some important aims are expected to be fulfilled. Genetic screening එකේ තියෙන expected outcomes තමයි to identify people with treatable genetic conditions that have been proved harmful if left untreated. The providing reproductive options for couples who might be vulnerable or having high probability of having children with severe untreatable diseases. This may include genetic counseling, diagnosis at the prenatal stage, and other reproductive options. Most importance of screening is screen pregnant mothers to find birth defects such as neural tube defects like spina bifida and Down syndrome. Most commonly genetic screening present in prenatal and newborn clinics. In Sri Lankan context එකෙත් ගොඩක් වෙලාවට newborn and maternal clinics වල තමයි මේ genetic testing කරන්නේ. එහෙම නැත්නම් ගොඩක් වෙලාවට genetic testing කරනවා අඩුයි. Application for genetic screening. Preconception screening. Prenatal screening. And then newborn screening. Then performing the nursing assessment involving genetics and genomics. Then that assessment should include assessment of the family, physical assessment, cultural, ancestral, and social and spiritual assessment. Cultural, you know that ancestral means history of the people, the relatives. Then psychosocial assessment. Yes. Huh? ඔයා මොන ස්ටුඩන්ට් කෙනෙක්ද? ලෙක්චර් එක Zoom වලින් නේ තියෙන්නේ. කවුද කියලා තියෙන්නේ? ඈ? දාලා ටයිම් ටේබල් එකේ දාලා තියෙනවා. අපේ Zoom වලින් තාම කරන්නේ. ඔයා ඔය ප්‍රස් ටයිම්ද ටයිම් ටේබල් එක දැක්කේ ප්‍රස් ටයිම්ද? කොහෙද වැඩ කරන්නේ? මෙච්චර මම ඉතරිලා ඉන්නේ. කොහෙද ගෙවන්නේ? මම ගාල්. ඔයා මෙච්චර කාලයකට ලෙක්චර්ස් වලට ඇටෙන්ඩ් වුණේ නැද්ද? ඒ කියන්නේ දැන් අපි මේ Zoom වලින් කරපු කිසිම ලෙක්චර් එකකට ඔයා ඇටෙන්ඩ් වෙලා නැද්ද? ඒ කියන්නේ දැන් මේ කොවිඩ් මාර්ච් වල ඉඳලම මේ අවුරුද්දේ මාර්තු දැන් මේ මොනවද යන්නේ සැප්තැම්බර් September 7 months එනවා නේද? එතකොට ඔයා මේ මොනවටද රෙජිස්ටර් වෙලා හිටියේ මීට? Sorry for disturbing you. මේගොල්ලෝ lectures වල ඉන්නේ ස්ටුඩන්ට්ස් ලත් එක. එතකොට ඔයා එතකම්ම මොනවටද රෙජිස්ටර් වෙලා හිටියේ කිසිම සබ්ජෙක්ට් එකකට ඇටෙන්ඩ් වුණේ නැද්ද? ඈ? මේ රිසර්ච් එකකට එකලා ඒකේ රිසිට් එකක් මම බබා දෙන්නත් එක පිළිගන්න දැන් මේ ෆස්ට් සෙමිස්ටර් එකේ මොනවද සෙකන්ඩ් සෙමිස්ටර් එකට තියෙන මේක විතරද? ඒකයි ඔයා දන්නවද Zoom වලින් ඇටෙන්ඩ් වෙන විදිය දන්නවද? එහෙනම් ඔයා ඉන්න වෙනවා ටිකක් ඒවා කියලා දෙන්න. ඔයාලට පුළුවන් නම් අපි ඩිපාර්ට්මන්ට් එක තියෙන තැන දන්නවනම් ඔයා එතෙන්ට යන්න. හරිද? මම එතන ඉන්න කෙනෙකුට කියන්න ඔයාලට ටික කියලා දෙන්න කියලා. ඒවා ටික අහගෙන ඔයා අද ගෙදර යන්න. ගිහිල්ලා මේවා සමහරට වීඩියෝ රෙකෝඩින්ග්ස් ඔයා ඊලර්න් එකට යන්න දන්නවද? ඒවා දන්නේ නැහැ. මොකක්ද දන්නේ නැහැ. මේ ඊලර්න් එකේ ගිහිල්ලා මේ රිසෝසස් ගන්න දන්නේ නැද්ද? කියන්නේ ලර්නින් රිසෝසස් දාලා තියෙන ඩවුන්ලෝඩ් කරගන්න දන්නවද? ඊලර්න් එකට යන්න දන්නවද? ඊලර්න් කියලා සබ්ජෙක්ට් ටික තියෙන තැනට කොහමද ඩැන්සින් ඩිපාර්ට්මන්ට් එකට යන්න මම මේ ඩෙමොන්ස්ට්‍රේටර් කෙනෙකුට කියන්නම් ඔයාට අවශ්‍ය දේවල් කියලා දෙන්න කියලා. ඔය ඔක්කොම විශ්ල ගන්න පුළුවන් මම දැන් මේ ස්ටුඩන්ට්ස්ලාත් එක්ක ඉන්නේ. හරි ඔයා එතෙන්ට යන්න ඒගොල්ලන්ට ඔයාගේ ප්‍රශ්න ටික කියන්නකෝ නර්සින් ඩිපාර්ට්මන්ට් එකට යන්න. හරි. Please, hello, can you hear me?
Yes, madam.
Please wait until one student came directly to participate in the day school. She doesn't know regarding the Zoom sessions. Can you understand how varied our students?
Yes, madam.
මාර්ච් වල ඉඳලම දන්නේ නැහැ. මෙහෙම එකක් තියෙනවා කියලාවත්. අද තමයි දන්නේ. කොහොමද එතකොට ඔයගොල්ලන්ව හැන්ඩල් කරන්නේ අපි? hello ඉෂාරා ඔතෙන්ට මේ ස්ටුඩන්ට් කෙනෙක් එයි නර්සින් එයා ගාල්ලේ ඉඳලා මේ ඩේ මන් දැන් කරන ඩේ ස්කූල් එකට පාටිසිපේට් වෙන්න කියලා මෙහි ඇවිල්ලා එයා මේ තාම ෆස්ට් සෙමෙස්ටර් එකේ මොකද ලියලා විතරයි ෆයිනල් එක දැන් කොහමද දන්නේම නෑ මේ Zoom වලට ගිහිල්ලා මේ Zoom lessons වලට attend වෙන්නේ කොහොමද කියලා පොඩ්ඩක් ඔයගොල්ලෝ ඒ Zoom එකට යන විදියයි ඒ Zoom session link එකක් දැම්මම මේ link එක හොයාගන්න විදියයි ඔන්නක පොඩ්ඩක් කියලා දෙනවද? එයා ආවා. හරි. දැන් මේ මෙතෙන්ට ආවා මම ඔතෙන්ට එව්වා. Hello.
Madam.
Yes, sorry. For in the nursing assessment involving the genetics and genomics යටතේ nursing assessment එකදී තියෙනවා assessment of the family තියෙනවා. මොකද මේ genetical issues and predispositions are having family histories. Then at the assessment, nursing assessment, it is one of the must the assessment of the family. Physical assessment. Hello, Maimi, Mama, ඉෂාරට පණිවිඩය කිව්වා. පොඩ්ඩක් ඉෂාරගෙන් හරි. Cultural and ancestral, social and spiritual assessment. Cultural means think of in the Sri Lankan context that patient is having thalassemia. Then she is having a culture. තැලසීමි කියන්නේ ලංකාවේ සමහර ප්‍රදේශ තියෙනවා ඒකට ප්‍රොමිනන්ට්. එතකොට ඒ ප්‍රොමිනන්ට් ප්‍රදේශات එක්ක එහෙම ඒගොල්ලන්ගේ කල්චරල් ඩිෆරන්සස් තියෙන්න පුළුවන්. then ancestral means ඒගොල්ලන්ගේ පරණ මුතු මිත්තන්ගේ විස්තර. then social and spiritual assessment. then psychosocial assessment, genetic counseling and evaluation. Those are the includings of a nursing assessment regarding genetics and in genomics care. This is the illustration for that nursing assessment. Then here it has mentioned that assessment of the family history. Nurse can conduct family assessment in any clinic setup, especially fulfilling the confidentiality and gaining the consent. Before you are doing that family assessment, you should get the consent of the participants or client. The most expected task to be fulfilled is to identify the genetic trait. Genetic trait means එයාට තියෙන ජෙනටිකල් හිස්ටරි එකෙන්ම තමයි ට්‍රේට් එක ගන්න වෙන්නේ. ට්‍රේට් එක කියන්නේ අපි කියමුකෝ එයා ඩවුන් සින්ඩ්‍රෝම් තියෙනවා නම් ඒ ට්‍රේට් එකේ යාට තියෙන්න පුළුවන් හෙයා ලිප්ස් තියෙන්න පුළුවන් පැලට් එක ප්‍රශ්නේ තියෙන්න පුළුවන් ගොඩක් ඒවා තියෙනවා අර බවල්ස් වල ප්‍රොබ්ලම්ස් තියෙන්න පුළුවන් ඒ ඩවුන් සින්ඩ්‍රෝම් කියන ජෙනටිකල් ට්‍රේට් එකත් එක්කන තව ජෙනටිකල් ට්‍රේට් එක කියන්නේ ඒ සින්ඩ්‍රෝම් එකක් විදිහට එනකොට ඒකත් එක්කන තව දේවල් ටිකක් තියෙනවා. දැන් අපි කියමුකෝ සමහරවිට predisposition එකක් තියෙනවා මේ diabetic mellitus වලට. ඒකෝට සමහර most probably ඒකත් එක්ක යාට cholesterol and hypertension, ischemic heart disease වගේ ඒවා තියෙන්න පුළුවන් ඒ history එකේ. Like that. Nurse can provide further information on education, testing, screening and any treatment that is being currently done to a patient. මේ assessment එක ඇතුලේ සහ මේ genetic counseling එක ඇතුලේදී patient කියන්න ඕනේ දැන් patients ලා දන්නේ නැහැ Tamanට එහෙම histories තියෙනවා කියලා දැනගත්තාම ඊට පස්සේ ඒවට technologically දැන් අලුතෙන් හොයාගත්ත testing, screening and treatment වගේ අලුත් දේවල් තියෙන්න පුළුවන්. ඒවා ගැන patient unaware නම් it should be made aware of patient. Here a pedigree for that for at least 3 generations has to be drawn and genetic family history. මෙතන මේ pedigree එකක් draw කරලා පෙන්නලා තියෙනවා. draw කරලා පෙන්නලා තියෙනවා 3 generations වලට. This is the first generation, this is the second generation. First generation, then this is the, you may see my cursor, then second generation, then third generation. Affected male, unaffected female. මෙතන තියෙන්නේ මේ male affected, මේ unaffected female. the third generation එකේදී ඉන්නවා affected male කෙනෙක් ඉන්නවා affected female කෙනෙක් ඉන්නවා. එතකොට මේ affected male එක එන අනික් partnerත් එක්ක එයාට එන්න පුළුවන් affected female කෙනෙක්. මෙතන එන්න පුළුවන් ලොකු tendency එකක් තියෙනවා නම් මේත් එක්ක affected males ලා දෙන්නෙක් ඇවිල්ලා තියෙනවා මේ generation එකේදී. Like that. Suppose if a woman more than 35 years age and considering a pregnancy or already pregnant, so a nurse can direct her for genetic testing for some anomalies like Down syndrome. Nurses have to inquire regarding history of the patients or family members with inheritable, for example, maternal health conditions like diabetes mellitus, type 1, seizure disorders and protein kinase urea can arise like risk of defected children. And then assessment, nursing assessment, physical factor assessment. Nurse is conducting physical assessment to a person and get revealed that the patient has hypercholesterolemia. With this, nurse may get a clue to check out on hyperlipidemia. Hypercholesterol වැඩියෙන් තියෙනවා නම් physical assessment එකේදී you may know as nurses some pigmentations in the face and in the eyes there are some physical symptoms with the hypercholesterolemia. Then with that clue then should be checked for hyperlipidemia. Physical signs like xanthomas, corneal arcus may be explored during the assignment. Once the signs were identified, the nurse can proceed by guiding them to further referral. That is the importance of this genetic and genomics care. Then assessment of the cultural, ancestral, and social and spiritual context. Ancestral assessment can be explained via example. Carrier testing for sickle cell anemia is routinely offered to people living African American descent. Then sickle cell anemia කියන එක African American descent එකේදී carrier කෙනෙක් ඉන්න පුළුවන්. එතකොට අර ancestral කියන assessment එකට උදාහරණයක්. ඒක nurse has to be empathetic as well as she has to consider about the view of the patient on a particular genetic condition and its significant effect on self-concept. There is a big impact on patients on the way that they think about genetic testing and overall of genetics on health. May genetic testing සහ ඒකේ influence එක ගැන patients කෙනෙක් handle කරනකොට ඒක very serious වෙන්න ඕනේ. මොකද හැමෝම එකම විදිහට ඒ findings සහ guidance බාරගන්නේ නැහැ මේ වගේ genetical දෙයක් ගැන කතා කරද්දී. Nurse should have best communication skills to handle these things. Then genetic counseling and evaluation services. Genetic counseling is a component required by several parties in the society. It is responsibility of the health staff to offer genetic counseling among them. The nurses plays an extremely vital role. මේ මුළු health team එකේම responsibility එකක් තමයි මේ genetic counseling කියන එක, but nurses is having extremely vital role for this genetic counseling. Components of the genetic counseling includes information and the source of the assessment, analysis of the data, communication of the genetic finding, natural history of the disease, the pattern of inheritance, reproductive of family health issues like that. Then counseling and support, follow-up, providing resources to get further information. There are pre-counseling factors also to be understood. According to the prevailing trends existing in the world, there are genetic specialists who are conducting the counseling process. The nurses have to involve in the counseling process in terms of providing basic information for their clients. To conduct this process, the consent of the patient must be obtained. It is and then close contact with the patient. If not, she can't do the job correctly. Once the genetic specialist prepare a summary on the patient or the family members, test results, they will be provided to the family members. After, the nurse has a very important duty to perform. Nurse has to review the summary with the patient's family members or the patient to identify the information, education and counseling required to prepare them for further follow-up. There are ethical issues also in this counseling. As nurses, it is a must to ensure the confidentiality and privacy of patient as ethical aspects. According to the American Nurses Association, that the most important ethical principle identified in the field as autonomy, fidelity and veracity. These are the most important principles. Nurse can advocate for maintaining patients' autonomy on arriving decisions regarding health. It is very much likely to occur ethical dilemma in the field of genetics and genomics in nursing. Their nurses have to manage the situation using ethical principles like autonomy, justice, and fidelity. The future of genetics and genomics in the world. Human Genome Project, the field of genetics and genomics steps toward a more advanced destination. Actually, then before, if we understood that we are having some predisposition for genetical disorders, we can test our genes before marrying a person, before getting a decisions for a marriage. We have to think of with the genetics and genomics to prevent some congenital diseases and to prevent some of our offsprings may having genetical issues like that. Then genetics and genomics has now focused in identifying the genetic and environmental causes of common diseases like cardiovascular diseases, diabetic asthma. This might have widened the path to reveal the prevention as well as the treatment of both common and rare diseases. Therefore, it is important since nurses will be the liners who will be working with patients and their family members. Nurses will be the main health staff who are communicating information to clients. It is important for nurses to understand current situation in the health field and its trend to move with these modern technological and scientific medical inventions. Actually, this is not a newest field, but in our Sri Lankan context, our Sri Lankan nurses are doing this care to some extent without giving a name for it as genomics care. Actually, nurses are practicing, Sri Lankan nurses, but we have not called it as genomics and genomics care. Then, but as students who are learning trends and issues in nursing, you should know that in the world there is a nurses called genetical nurses. Then there are nursing specialization called genetics and genomics in nursing is important aspect in current world. And you should know that what are the role of that nurse, what are the new trends in that field, like that. Then shall we go to the next session? I assume that you are hearing me. If there is any earlier session, do you have any clarification regarding genetics and genomics in nursing? Can you hear me?
No, madam.
Yes.
No, madam.
Yeah. You have to read out the given stuffs and given uploaded sessions, because the first NBT I will not touch these sessions, only that 10 sessions uploaded earlier, and the PowerPoint presentations I have uploaded at very first learning resource. But this I will get these, assess these in the next NBT, NBT2, okay? Then this session is workplace incivility. This is also a not broadly spoken topic in nursing books. But I thought this topic is also very important because most of the times in nursing context, workplace incivility in health hospitals and health services centers, it is there. So that we should, as nurses, you should understand the importance of knowing that what is workplace incivility and civility. Then, as introduction, we can describe it as low intensity deviant behavior with ambiguous intent to harm the target. That is the operational definition some Anderson and Pearson given, but when we discuss it as in simple words, in due to workplace incivility in behaving workers and co-workers not favorable for others. That means තමන් එකට වැඩ කරන තැන ඉන්න අනික් අයව let down කරන එක, අනික් අයට harass කරන එක, අනික් අයගේ opinion එකක්, not giving chances to give others opinions like that. We called it as a incivility. Incivility, I can't remember Sinhala term. Incivility means a sister. Sister වෙනවාට තමයි civilized වෙනවා කියන්නේ sister වෙනවා කියන එක. එතකොට incivility means sister ලෙස හැසිරීම වගේ එකක් තමයි incivility කියන meaning එකෙන් එන්නේ. We can say that employees decrease work effort because of this incivility. Time on the job, productivity and performance also get lowered due to this incivility in the workplace. If incivility is not identified or solved, job satisfaction and organizational loyalty diminish as well. Some employees leave their jobs solely because of their impact of this workplace deviance. දැන් සමහර හොඳ වර්කර් කෙනෙක් නිශ්ශබ්දවම ඒ ඕගනයිසේෂන් එකෙන් අයින් වෙලා යන්න පුළුවන්. ඒගොල්ලන්ට එතන රෙකග්නිෂන් එකක් හරි සතුටක් හරි නැත්නම් ඒ ජොබ් එක කරන්න. Incivility is well known problem in healthcare. Healthcare වල you may know as nurses, it is a well known problem. Evidence shows that incivility has impact on productivity. It jeopardizes the patients as well as healthcare professional. Safety and reduce the morale of a unit. යම්සි unit එක ඉන්න අයගේ morale එක අඩු කරන්න එක බලපානවා. Then incivility in nursing is a global issue. මේක global හැමතැනම අපි දන්නවා ලංකාවෙත් මේක තියෙන දෙයක්. Any disruptive and inappropriate behavior in the workplace demonstrated by one employee to another who is in a positions of equal, higher or lower level. Incivility can be in the form of lateral, horizontal, ascending, descending. Recognize කරන්න නැති එක, අනික් අයට කතා කරන්න නොදෙන එක, අනිත් අය නිකන් පාගගෙන වගේ ඉන්න එක, අනික් අයගේ අදහස් වල රිජෙක්ට් කරන එක, ඒ වගේ දේවල් ඒක patient-ට ultimately බලපානවා. මේක මේ lateral, horizontal, decrease in ascending, descending කියන්නේ same level එකේ අය අතරත් වෙන්න පුළුවන්. Then you may know you are working at as a nurse in a unit. Same level එකේ nurses ලා අතර වෙන්නත් පුළුවන්. ඉහළින් ඉන්න nurse ගෙන් පහළින් ඉන්න nurse ට වෙන්නත් පුළුවන්. පහළින් ඉන්න කෙනාගෙන් ඉහළින් ඉන්න කෙනාට වෙන්නත් පුළුවන්. හැම පැත්තටම මේක වෙන්න පුළුවන්. How incivility differs from civility? You should know it. Then actions of civility. Going out of own way to help someone. Then හොඳ ශිෂ්ට සම්පන්න They තමයි helping someone acknowledge mistakes and making appointment amends. තමන්ගේ mistake එකක් acknowledge කළා ආය අවස්ථාවක් දෙන එක. Saying please or thank you. Using positive tone of voice. Voice එකේ තියෙන්න ඕනේ tone එක. සමහර කෙනෙකුට කියන්න පුළුවන් මම එහෙම කිව්වේ නෑ. මම එයාට මුකුත් කිව්වේ නෑ කියලා. but ඒකේ මොකක් හරි නොකිව්වයි කියලා කියන එකේ tone එක තුල එයාගේ rejection එක තියෙන්න පුළුවන්. Apologizing when to something that offends someone, refusing to participate in gossip වලට participate වෙන එක refuse කරන එක, showing respect for other people's feelings and opinions, අනික් අයගේ feelings and opinions වලට respect කරන එක. Then actions of incivility, uncivil behavior. Humor out, put down, eye rolling, heavy sarcasm. ගම් අනික් අයව විහිළුවට ලක් කරන එක. පහලට දාලා කතා කරන එක. eye rolling කියන්නේ ඇහෙන් කියලා නිකන් අනික් කෙනා ඒකට let down කිරීම. heavy sarcasm ඒ කියන්නේ නිකන් sarcasm කියන්නේ මේ කද්දේකට සිංහල වචනයක් කියන්නේ sarcasm කියන්නේ විහිළු වට ලක් කරනවා වගේ එකක් මේ එහෙම heavy sarcasm. Interrupting meeting and conversations. යම් කිසි meeting එකක් conversation එකක් තියෙනකොට ඒකට බාධා කරන එක. That is incivilized behavior. කවුරු හරි කට්ටියක් ඒක ගැන සාකච්ඡා කරමින් ඉන්නකොට ඒක කරන්න දෙන්නේ නැතුව බාධා කරන එක. Yielding first, pounding. තමන් නිකන් ඉල්ලා හිටින එක නිකන් මෙහෙම කරන්න කියලා තදින් ඉල්ලා සිටින එක. Chipping away at someone's self-esteem. යම් කිසි කෙනෙකුගේ self-esteem එක බිඳවට්ටන එක. Ignoring others' opinions. Addressing people in the unprofessional manner. Unprofessional විදිහට අනික් අයව address කරන එක. Social isolation. යම් කිසි කෙනෙක්ව කොන් කරලා තියෙන එක සමාජ socially යම් කිසි කෙනෙක්ව ගණන් ගන්න නැතුව එහෙම තියෙන එක. Not giving credit where due. කාට හරි credit එක ලැබිය යුතු තැනදී නොදී සිටීම. යම් කිසි ක්‍රියාවක් හරි යම් කිසි දෙයක් සම්බන්ධයෙන් එයාට ඒ credit එක ලැබෙන්න අවශ්‍ය තැනදී ඒක නොදී සිටීමත් uncivility වලටම uncivilized behavior එක. Uncivil behaviors are characteristically rude and discourteous, displaying a lack of regard for others. Some harmful actions may be more, or while other forms of incivility and bullying can be more convenient. Incivility, nursing wali incivility walata root causes. Mulika hetu. High workload intensifies feeling of frustration. Workload එක වැඩි වුණාම frustration වැඩි වෙනවා. Time pressure and stress, which may result in increased perceptions of uncivil actions. මේ විදිහට uncivilized behaviors වලට workload එක, frustration, time pressure and stress. Nurses under stress may experience weakened ability to judge others' behaviors accurately and display diminished tolerance for unusual actions. Nurse la me stress එකේ ඉන්න nurses ලට දුර්වලතාවයක් එනවා. අනික් අයගේ behaviors judge කිරීමේ හැකියාව, අනික් අයගේ unusual actions tolerate කිරීමේ හැකියාව අඩු වෙනවා. Those with high workload may think that uncivil behaviors are needed to complete duties well. In other words, they may think there is not enough time to be nice. Then individuals who engage in the acts of incivility often exhibit poor self-esteem, have poor social skills, are abusive, and lack of self-restraint. Then these are individuals will engage in behaviors which are aimed to bring down other nurses who are perceived as someone who may be achieving or more successful. Then nurses lage මේක හේතුවක් තමයි මේ අපිටත් තේරෙන දෙයක් තමයි stress එකයි time pressure එකයි ඔය කියපු ටික. root cause එකක්. The primary reason for occurrence of uncivil behavior is nurses being in an oppressed state. Describes oppression as unfair, unjust, cruel governance or use of authority by those in positions of power. Oppression deprives individuals and groups of their rights, which leads to feelings of insecurity, shame, self-doubt and anxiety. මේ oppression කියන එක නර්සස්ලට ගොඩක් වෙලාවට ඉහළින් ඉන්න නිලධාරීන්ගෙන් විරෝධතාවයකට ලක් වෙන්න පුළුවන්. Oppressed groups feel powerless in the face of their oppressors and turn their frustrations inward and toward other group members. මේ නර්සස්ලා කියන්නේත් oppressed group එකක් තමයි. එතකොට ඒගොල්ලෝ වැඩ කරන තැන්වල ඒගොල්ලන්ව recognize වෙන්නේ නැති ස්පෙෂල් ඒ තමන් powerless තත්යකට පත් වෙලා තමයි oppressed group ඉන්නේ. බලයක් නැහැ වගේ. දැන් එතකොට වෙන විදිහවල් වලින් බලය අතට ගන්න වගේ පෙළඹෙනවා. අපි කියමුකෝ hospital එකක ඉන්න nurses ලා කිව්වහම ඒගොල්ලන්ට decision making වලට autonomy කියන්නේ self decision making වලට බලයක් නැත්තම් හැමදේම ඉන්ෆ්ලුවෙන්ස් කරනවා නම් ඉහළින් ඉන්න මොකක් හරි ඇඩ්මිනිස්ට්‍රේටිව් ගෲප් එකක්. එතකොට ඒක අනික් තමන්ගේ ලෙවල් එකේ අය අතරටත් ඒ ඉන්සිවිලයිස් ගතිය යනවා. එහෙම නැතුව තමන්ට ඉහළින් ඉන්න අයට විරුද්ධව කටයුතු කරන්න හිතෙනවා. පහළින් ඉන්න අය ඒ විදිහට ඔප්‍රෙස් කරන්න හිතෙනවා. අන්න ඒ වගේ තත්ත්වයක් එනවා. Another possible reason for bullying is how and what nurses are taught. When student nurses are subjected to bullying by nurses in practice, student nurse කෙනෙක් වෙලා ඉන්නකොට practice එකේ ඉන්න nurses ලා ඒගොල්ලන්ව bully කරනවා. They are more prone to follow behaviors to engage in bullying activity. Moralization and the profession is mostly female are led to the incivility. Nurses, through their education and work experiences, are led to believe they cannot or should not assert themselves. Assertiveness කියන එක ගැන ඔයගොල්ලෝ ඉගෙනගෙන ඇති. ඒගොල්ලෝ විශ්වාස කරනවා තමන් වෙනුවෙන් assertive වෙන්න බෑ වගේ. If nurses perceive bullying as normal behavior, තමන්ට මොකක් හරි දෙයක් කරන්න කියලා බල කරන එක. ඒ කියන්නේ මොකක් හරි විදියකට ඉන්න කියලා හරි හැසිරෙන්න කියලා හරි කරන්න කියලා හරි බල කරන එක normal කියලා හිතන තැනට අර ස්ටුඩන්ට් නර්ස්ගේ කාලේ ඉඳන්ම වැටෙනවා. They may turn a blind eye to the bullying around them and in some cases deny it occurs. ඒගොල්ලෝ නිකන් blind මේ ඕත කියන විදිහට ඒ දැන් තමන් බුලි වෙනවා කියලා. ඒ කියන්නේ තමන් තමන්ට බලපෑමක් යටතේ වැඩ කරන්න වෙලා තිනවා බල කරනවා ඒවා කියන එක නොතේරෙන තරමට නිකන් අර පුරුදු වෙලා ඒක මේ අර මීරියලින්ට වීණා වයනවා වගේ කියලා කියන්නේ ඒ වගේ තත්යකට වැටුනහම ඉතින් ඒක තමයි normal situation එක වගේ හිතිලා under pressure අනික් අයගේ hindrance වලට යටත් වෙලා ඔහේ ඉතින් වැඩ කරගෙන ඉන්න තත්යකටපත් වෙනවා. ඒතකොට they don't know that they are bullied. Okay. Impact of incivility in nursing. Outcome of incivility on nurses can be viewed in terms of the individual, interpersonal relationships, productivity, and can contribute to unhealthy work environments that ultimately have a negative impact on the quality and safety of care delivered. මේ incivility කියන එකෙන් අවසාන වශයෙන් සිද්ධ වෙන්නේ අර patient දෙන care එකේ quality එකයි safety එක හැම තමයි නැති වෙලා යන්නේ. The impact of incivility in nursing for patients. Any uncivilized behaviors ultimately harm the patient. Nursing is a very challenging and demanding profession where one's intellectual and emotional self must work in synchrony to provide competence and comprehensive care. When the work environment is polluted with negativity කියන්නේ negative දේවල් වලින් in working environment එක pollute වුණාම it makes the job of providing quality care challenging. However, if the team members are distracted or cannot work together, patients may be at risk. A nurse who is psychologically aggressive and uncivil in the workplace may not turn it off. Then they go into the patient's room, thus the patient's vulnerable to the effects of negative behaviors. ඒ විදිහට ඒ නර්ස් කෙනෙක් ultimately aggressive and negative behavior එක ඉන්නවා නම් ඒක that client also vulnerable to get the effects of that negative behavior. New nurses early in their career are likely to encounter variously offensive behaviors which violate the principle of equality and respect. අලුතෙන් එන නර්සස්ලා ගොඩක් වෙලාවට ඒගොල්ලන්ගේ කැරියර් එකේ මුලදී violate කරනවා principles of equality and nurses' physical and mental health. According to Hooper, traumatized nurses would function as the walking wounded. When the stress caused by adverse working conditions are not dealt with appropriately, the worker's mental and physical health has been shown to be impact from incivility. Mental physical health එක deteriorate වුණාම තමයි nurses ලාගේ this incivilized behavior is coming out. Most of the time, new nurses are complaining that they are giving unfavorable assignments or are mandated for often than others are, regardless of seniority or frequency. They claim that their requests are often ignored The negativity in the work environment because of incivility is lower the self-esteem, damaged relationships, decreased morals, increased stress, and increased turnover rates, which this is said to impact the organization's bottom line. Anyhow, මේ නර්සස්ලට මෙතන අපි කතා කරේ newly recruited නර්සස්ලා ගොඩක් වෙලාවට හිතනවා තමන්ට unfair, unaffordable, unfavorable assignments ලැබෙනවා කියලා. එහෙම හිතලා ඒගොල්ලෝ මේකට මේ තියෙන සිස්ටම් එකට absorb වෙන්න කලින් ඒගොල්ලන්ගේ අර behaviors එන්න පුළුවන්. There are the impact of incivility in nursing for healthcare organization. When we consider as a hospital as a healthcare organization cannot respond properly, these uncivilized behaviors may lead to adverse organizational effects, such as the absenteeism, less organizational citizenship between, slow down productivity, lower job satisfaction, lower organizational loyalty, and even heightened turnover intentions. Individuals who experience uncivil behavior tend to conduct a relatively action to be offered. With departure of experienced nurses, the unit, their knowledge and experience also gone. This decreased the number of human resources for patient care. Being a victim of incivility is also costly to organization due to nurses put in less effort. Like that, incivility is a significant problem in healthcare settings. And then now 1.4 strategies to prevent incivility in nursing. Incivility can be prevented in multiple stages. Primary prevention initiatives are also aimed at improving interpersonal and interprofessional relationships. Secondary intervention strategies are designed to reduce harm on an incident of workplace violence. Has begun and tertiary strategies aim to reduce the consequences associated with such an event. Therefore, it can be recommended the strategies for both employer and employees, individual and organizational level. May incivility සඳහා ගන්න strategies වලට ඒක organizational සහ individual level එකකින් strategies හදන්න පුළුවන්. Then under the strategies, primary prevention, intervention intended to address vulnerabilities and improve interpersonal and interprofessional relationships. Recommendations for registered nurses. You can read on these. There are some recommendations for registered nurses to decrease the incivility in their practicing setups. This is the summary for this incivility in nursing. Incivility in the workplace is also known as horizontal violence or workplace bullying. Incivility is rude, disruptive, maintaining, and undesirable behavior that are different towards another person. There is an activity reflect on the issue of incivility affecting nurses in nursing workplace. Critically discuss the possible root causes for it and recommend strategies for your workplace from the aspects of communication and professionalism. Then better to go for the next session, the 13, rise of nurse navigator role. This is also a new aspects of nursing, and this is in newest addition to nurses role. This has include, can you hear me?
Yes, madam.
Yes. Definition of nurse navigator, desired qualities of a navigator role, key roles of nurse navigator, principles of navigation, benefits towards patient. I have to tell you that, emphasize to you that when you are studying these new topics, that you may find new words not having in your mind that the meaning of that terms. Then you have to search those terms in the web, right on the Google, for the meaning. Then you can get an idea other than this, that in simple terms or in simple words or in another way it may be explained. Then nurse navigator is told means maybe a new word for you. Then you should go for Google and search on what is nurse navigator. Then getting some idea, you can come up to the session. Then it will facilitate you to more understanding of the reading session. Okay. The nurse navigator. Shall we think of who is nurse navigator? The nurse navigator are specially trained nurses who help guide, educate, and coordinate patients through the care process and act as a liaison among caregivers and physicians. Nurse navigator කියන්නේ යම් කිසි client කෙනෙකුට ඒ nurse guide කරනවා, educate කරනවා, help කරනවා, diagnose test ගැන suggest කරනවා. එයා තමයි ඔක්කොම navigate කරන්නේ patients ගේ role එක. එයා explore කරනවා ඒ patient වෙනුවෙන් මොනවද කරන්න පුළුවන්. අපි කියමුකෝ දැන් patient ගේ situation එකක් තියෙනවා. අපි as an example, think of that patient is having kidney failure තියෙනවා කියමුකෝ with unknown etiology. Then nurse navigator is the person who are searching out what are the where are the testing centers, where are the dialysis units, what is the most possible and easy place for treatments, what are the tests should be done with the government sector, what are the tests 100% go for the private sector in this Sri Lankan context. How much is the how much the money is needed for getting some instruments or drugs or treating for the treatment. Some are not available in the government sector, then they have to buy from the local pharmacies. Then how much is it that? All the things are searching out by one nurse, and she is called as navigator nurse. Okay. The word navigate is derived from two Latin words, navis, ship, and agri, to drive. The meaning of word navigate is to travel or through safely. Navigation is a process whereby a patient is given personalized care. Navigator කියන process, navigation කියන process එක මගින් patient is giving personalized care and support across the continuum of patient care. The nurse navigator focus mainly on the clinical aspects of care. There are definitions for nurse navigator. According to American Nurses Association, a function that helps ensure that the patient's needs and preferences are met over time with respect to health services and information sharing across people, functions, and site. In other words, nurse navigator act as a single primary point of contact for patients through all aspects of their treatments, such as helping set up follow-up appointments. These are includes in the role of nurse navigator. Helping set up follow-up appointments, answering questions, educating patients and their support system, acting as a liaison between the patient and other caregivers, coordinating care across several departments, helping with transition from medical facilities to home, providing advice on things like where chemotherapy patients can shop for wigs. Chemotherapy patient කෙනෙකුට wig එකක් ගන්න නම් කොහෙන්ද ගන්න පුළුවන්? දැන් ලංකාවේ නම් තියෙනවා නොමිලේම දෙන ඒ සර්විස් එක දෙන තැන්. එතකොට ඒ වගේ ඒවා තියෙනවා කියලා ඔය ඈත පළාත් වලින් එන කැන්සර් හොස්පිටල් එකට එන patient කෙනෙක් වෙන්න පුළුවන්. එතකොට එයාව ගයිඩ් කරන්න ඒ වගේ දේවල් වලට එහෙම. A nurse navigator will guide your way through your cancer journey. Not only for the cancer, sometimes the nurse navigator role is not only for the cancer, but also for any type of disease conditions. But in some examples are having for that, they will be a one-on-one contact person, resource and guide, educated and help throughout the entire course of treatment and even after treatment has ended. Then nurse navigator is a nurse that plays many roles for the benefit of patients. She is not playing one role, but she is playing many roles. This includes acting as an educator, advocate, liaison, coach, coordinator, guide, and problem solver. Nurse navigation is the broad role of supporting an individual patient in a meaningful and comprehensive way, helping to compassionately navigate a patient's cancer journey. History of nurse navigator role. The navigation concept was introduced with Dr. Harold Freeman. Dr. Harold Freeman කියලා කෙනෙක් තමයි මුලින්ම මේ navigation කියන concept එක introduce. He was the cancer surgeon. He was the cancer surgeon and former president of the American Cancer Society. He held nationwide hearing that determined that poor patients face enormous barriers when endeavoring to obtain cancer care. මේ cancer care කියන එක ගන්න ගියාම poor patients ලා විවිධ barriers වලට face කරනවා කියලා තමයි යා කියන්නේ. The first navigation program was established by him in 1990 at Harlem Hospital in the New York. Through his medical practice, Dr. Freeman became vigilant that patients who were impecunious and minorly presented with advanced stages of cancers and were more liable to die from their diseases. Then anyhow, the main aim was to eliminate barriers for treatment and supportive care. First navigators participated to this program. Were laypersons in the community and the volunteers. The navigator will focus not only specific disease or conditions, but they focus on the patient's health needs and their entire healthcare journey. Actually, I think like that this nurse navigator role is performing in Sri Lankan nurses also everywhere, but the one of the nurses' duty is extracted from her and given name as navigation, like that, because every nurses are doing these things in their care, but in the current context, they have extracted some parts from that care and they have given a name, a nice name. It's called as navigation. Okay. 5.2, it is desired qualities of a nurse. Then clinical skills and clinical competence is important to become a successful nurse navigator. Clinical skills and clinical competence in to become a professional nurse navigator, the following qualities should be developed. To become a professional nurse navigator, the following qualities should be developed. Then one is strong communication skills. Nurse navigator cannot work alone without a multidisciplinary team and with others. In order to meet patients' need, their practice should be multidisciplinary and require a reliable, open, and effective communication. Then cultural openness. Next quality is cultural openness. The nurse navigator should have good understanding about the patient. respect their cultural values and beliefs, all which may be very different from the navigator's personal culture and beliefs. Then navigation role එකේ තමන්ගේ nurse ගේ තියෙන personal cultural context එක or beliefs and values වලට වඩා different values beliefs වල ඉන්න පුළුවන් patient. Then nurse should have good understanding of that. If not, she cannot be a good nurse professional navigator. The navigator should be a good listener and be a liaison between the patient family caregiver and the medical providers in developing a plan that is medically sound and culturally acceptable. The medically sound and culturally acceptable plan එකක් හදාගන්න නම් nurse navigator හොඳ listener කෙනෙක් වෙන්න ඕනේ, liaison කෙනෙක් වෙන්න ඕනේ දෙපාර්ශ්වය අතරේ convey කරන්න පුළුවන් messages. Respect for the next quality is respect for others. අනිත් respect කරන කෙනෙක් වෙන්න ඕනේ. The nurse navigator must respect and maintain the dignity of every stage of human life. Human life එකේ හැම stage එකකදීම respect කරන dignity එක maintain කරන කෙනෙක් වෙන්න ඕනේ. Respect their choices, priorities. එන ඕනම life stage එකකදී විවිධ choices තියෙනවා. වයසට ගියාම එක choice එකක්, young age එකේදී තව choice එකක් එහෙම. Priorities, beliefs and values. Nurse navigator role requires the healthcare provider to be especially vigilant in this area and to show patience and understanding while setting reasonable boundaries and expectations. Then commitment to patient confidentially. Most nurses are emotional to patient confidentiality. It is the main duty of the nurse to care towards patients while maintaining the privacy and the confidentiality. Then key roles and principles of nurse navigator. Nurse navigator roles and responsibilities vary depending on the nurse's level of preparation and healthcare setting in which he or she working. But all nurse navigators advocate for patients by helping translate complex medical information into language they can understand and apply and making the overwhelming more manageable. ඉතාම සරලව කිව්වොත් nurse navigator කරන්න තියෙන අර complex medical information එක සංකීර්ණ medical information ටික ඉතා සරලව patient ට convey කරන එකයි patient ගේ need එක identify කරගෙන nurse ලබා දෙන එක තමයි role එක. Then in providing patient-centered care, nurse navigators may do any or all of the following. Patient-centered care එකක් දෙන්න නම් මෙන්න මේවා කරනවා. Educate patients about their disease conditions. Nurse navigator role එකේදී තියෙන main එකක් තමයි educate patients about their disease conditions and side effects, prescribe treatment and how to manage them. Provide clinical resources, advise patient how to seek a second opinion. Second opinion එකක් ගන්න කොහොමද කියලා යමක් පිළිබඳව. The treatment or testing options that may not be available within the country. දැන් මොකක් හරි diagnosis එකක් තියෙනවා නම් patient කෙනෙකුට ඒක believe කරන්න අමාරුයි. හරි ඒක ලොකු finding එකක් නම් එයාට තව second opinion එකකට යොමු කිරීම තුළ that patient may find it easy to tolerate that decisions or diagnosis. Assess patient's psychosocial status, distress, and referral to a medical professional or counselor if more intensive support or treatment is needed. Answer questions as appropriate and refer to the physicians for additional questions and treatment options. Address the tactile barriers to aid such as monetary resource, living accommodations, transportation, child care, prescription cost, and much more. They refer patients to be appropriate contact such as a social worker. Social worker කෙනෙක් වගේ කාට හරි දැන් ලොකු ඩයග්නෝසිස් එකකදී යාට තියෙන මුදල් ප්‍රශ්න ඒකේ ආයක ගන්න වෙන්නේ කොළඹ ඇවිල්ලා අපි කියමු කැන්සර් එක කැන්සර් හොස්පිටල් එකේ ඉන්න ඕනේද එහෙම නැත්නම් ඒ හොස්පිටල් එක කිට්ටුව හොස්පිස් වගේ ඒවා තියෙනවාද ඒගොල්ලන්ට ඇකොමඩේට් වෙලා කෙයා එක ගන්න පුළුවන් ඒවා හොයලා එහෙම නැත්නම් තව ඊට එහා ඈත තැනක ඉඳලා එන්ඩ ට්‍රාන්ස්පෝර්ටේෂන්ස් තියෙනවාද එයාට ළමයි ඉන්නවා නම් ගෙදර එයා ට්‍රීට්මන්ට් ගන්නකම් ඒ ළමයි බලන්නේ කවුද ඒවට ඩේ කෙයා තියෙනවද එහෙම නැත්නම් රිලේටිව්ස්ලා ඉන්නවද මොකක් හරි ප්‍රෙස්ක්‍රිප්ට් කරනකොට මොන හරි ඒකට කොස්ට් එක කොහොමද කරන්නේ මේ වගේ ගොඩක් ප්‍රශ්න තියෙනවා. ඒකට ඒවට ප්‍රොෆෙෂනල් ඉන්වෝල්ව්මන්ට් එකක් දෙන්න පුළුවන් වෙන්න ඕනේ මේ නැවිගේටර් නර්ස්ට. Ensure the health information that provided is easily accessible. This may include securing documents printed in the patient's own language or arranging a certified medical interpretation. සමහර දේවල් සමහර patientsලට තමන් ටැමිල් අපි කියමු ශ්‍රී ලංකන් කන්ටෙස්ට් එකේ සමහර ටැමිල් patients කෙනෙකුට සිංහලෙන් දෙන සර්ටිෆිකේට් එකක් හරි මොකක් හරි report එකක් හරි තේරෙන්නේ නැහැ. එහෙමනම් එයා ඒකේ ඉංග්‍රීසි version එකක් හරි translation එකක් හරි අරගෙන දෙන්න intervene වෙන්න ඕනේ. පුළුවන් එහෙම පුළුවන්කමක් තියෙනවා නම් intervene වෙන්න ඕනේ. Function as a member of an interdisciplinary team to assess, secure and coordinate appropriate services through the continuum of care. Empower patients, families and caregivers to assume as much responsibility to their care as possible within the constraints of age, illness and other factors. A patient family and caregivers lava may පිළිබඳව දැනුවත් කරන්න ඕනි comprehensively. Promote awareness of clinical trials as appropriately during the consultation with the other members of the healthcare team. Provide maximum support during the scheduling of appointment scheduling කරනකොට යාට supportive වෙලා යාට දුර බැහැරක නම් ඉන්නේ සහ යාගේ agendas එක හරියන appointment එකක් අරගෙන දෙන්න try කරන්න ඕනේ. Procedures and diagnostic test උනත් එහෙමයි. Educate, identify patients for genetic counseling or fertility preservation and facilitate appropriate referrals. The key principles associated with the nurse navigator role. First one is coordination of patient-centered care. පළවෙනි principle එක. දෙක. Under that coordination of patient-centered care, the nurse should enhance the reputation of providers among healthcare consumers, provide the maximum effective care to the selected sample of patients. Second one is under that enhance the patient quality of life, like that. Then second one is creating partnerships. Okay. Under the key principles of navigator role, second one is creating partnerships. Facilitating central point of communication. Use innovate. Hello. use innovative communication pathway to establish effective lines. Then improve, third one is, third principle is improving persons' outcomes. We are discussing regarding the key principles of navigator, nurse navigator role. First one, we mentioned first one as coordination of patient-centered care. Under this, there are some points. Then creating partnerships. Then facilitating the central point and using innovative communication. Third one is improving patient's outcome. Delivering effective care, then improve the health literacy, knowledge to support patients and their families. Then enhance broad access to specific services. Duty of the practitioner to maximize positive patient health outcome. Then facilitate systems improvement. Providing authority to part with an organization and conduct quality improvement activities for facilitating system improvement. Care system එකේ improvement එකක් facilitate කරන එකත් අර nurse navigator role එකේ one of the main thing. Then connectedness or relationship between nurse navigator and the patients. Benefits towards patients from the nurse role of nurse navigator. Patient ලැබෙන benefits තමයි building patients awareness regarding their issue, manage patients' own health and better preparing their journey through the system, healthcare system. Inform about the pros and cons of treatment options, providing emotional support to patient and families, provide resources for physical and psychosocial support. Then patient's expectations from a nurse navigator. Information, privacy during discussion, those are the expectations of patient. Confidentiality, treated with dignity and courtesy, comfort with receiving treatment, continuity of care for as long as the client desire to express their opinion about the quality of services received by them. Overview of the service provided by nurse navigators. Why is this service being delivered by nurse? Nurse navigators provide their main priority on patients present with complex health conditions and patients those who are require high degree of clinical care. Nurse should have specific of clinical skills to identify patients with complex health conditions. Actually, in our country, the role like nurse navigator is not established, but in other Western countries, it is established. I think in our country also, if the patients are with resources and some people are not having resources, some patients like afford කරන්න පුළුවන්, සමහර අයට afford කරන්න බෑ. But in our countries like ours, both categories, having affordable and not affordable, both are suffering. යම් කිසි කෙනෙකුට නර්ස් නැවිගේටර් කියන කෙනෙකුගේ සහාය ගන්න පුළුවන් නම් තමන්ට සල්ලි වියදම් කරන්නත් පුළුවන් නම් nurses can do a private practice as nurse navigator. Private practice එකක් කරන්න පුළුවන් nurse ලාට තමන්ගේ job එක කරනවා පැය 6ක්. ඉතුරු පැය 6 තව කවුරු හරි patient කෙනෙකුගේ navigator role එක කරනවා. එයාගෙන හොයලා බලලා එයාට treatment options හොයලා දීලා care එක coordinate කරලා ලාභයට ඩ්‍රග්ස් හොයලා දීලා කම්පැනි වලට කතා කරලා ඒ වගේ එකක් කරන්න පුළුවන් කවුරු හරි නර්ස් කෙනෙකුට. The potential outcome measures for nursing navigator positions. Reduce the duration that the patient stay at the hospital. මේ nurse navigator කියන එකත් එක්ක තියෙන potential outcome. patient ගේ residential duration එක අඩු වෙන එක. Reduce readmission rates. Reduce unscheduled care presentations. Increased patient and clinician satisfaction. Quality of life indicators. Reduce standardized mortality ratio. Reduction in number not ready for care. care එකට ready නැති number එක අඩු කරන එක. Then activities there, what are the potential outcome measures for patients from the role of nurse navigator? Then you have gone through a summary. Objectives is there. When you are preparing for the assessments, you can use these objectives. Then I will wind up these sessions now. If you have any queries regarding this nurse navigator role, I can respond it now. Do you have any questions? Please speak out. Do you have any questions? Any questions regarding nurse navigator role?
No, madam.
No?
No, madam.
Yes, you can read out again and again these given sessions, and if you have any problem with terms, new terms, I suggest you to search out in the web, in the Google search box for any unknown terms relevant to these new topics. If not, if you are having another further problems, you can message in e-learn platform to me regarding those questions. Then next day school will have been placed to next 5th of October because one day school was postponed last week. That day school will have been scheduled at I can remember as 5th October. You can see in the announcements, we have mentioned that postponed day school will be conducted on this day like that, as I remember it, 5th October, before the first NBT. But I will evaluate you for the first NBT. Many students are asking again and again that I have published at the announcements and of the e-learn also. Only first session, 10 sessions I uploaded at the e-learn. 10 සහ PowerPoint presentation එකක් මම මුලින්ම ඔයගොල්ලන්ට මුලින්ම මේ course එක පටන් ගන්නකොටම PowerPoint presentation එකක් upload කරලා තියෙනවා learning resources වල. අන්න ඒ PowerPoint presentation එක සහ ඊට පස්සේ මෑතකදී ගිය සතියේ වගේ අප්ලෝඩ් කරපු 10 sessions තියෙනවා මේ කලින් කරපු ඒවා මේ ඒවත් ඇතුළුව written session 10ක් දාලා තියෙනවා. අන්න ඒකෙන් තමයි ඔයගොල්ලන්ව evaluate කරන්නේ NBT 1 වලට. Only that 1 to 10 sessions and 1 PowerPoint presentation only using for NBT 1. Okay? Do you have any question regarding NBT 1?
No, madam.
No, NBT 1 is
madam 30th තියෙනව නේද? තව ක්ලාස් එකක් මේ මාසේ
30th
10 to 12 ටයිම් ටේබල් එකේ එහෙම තිබුණා මැඩම් මම මාක් කරගෙන තියෙනවා.
මම ඒක තියෙනවා. ඒක තියෙනවා අර පෝස්ට්පෝන් වෙච්ච එක තමයි next 5th වලට ගියේ. next 30th means next week Tuesday, isn't it?
මැඩම් මේකේ මේ කෝස් මැටීරියල් එකට අප්ලෝඩ් කරනවද?
ඔව් අප්ලෝඩ් කරනවා.
right okay.
job publishing වලට හදලා නැති හින්දා දැම්මේ නැත්තේ 30th day school එක මට තියෙනවා තමයි මටත් මතක් වුණා next week එකේ ඒ day school එකට අදාළ sessions ටික as soon as possible I will upload I will told to the demonstrator to upload then
right okay madam.
next
අද රෙකෝඩින්ග්ස් දානව නේද මැඩම්?
මොකද්ද
රෙකෝඩින්ග්ස් දානව නේද?
recordings දාන්න
රෙකෝඩින්ග්ස්
මේ recordings heavy වැඩි හින්දා මේ 2 hours නෙමේ recordings ඒතර upload කරන්න ගියාම ටිකක් පොඩි problems එනවා මේ දැන් recording එක පැය දෙකක් එක දිගට හින්දා I will ask to do save it in the Google Drive and upload. I will try my best to upload the recordings also.
Okay madam, thank you madam.
මැඩම් රෙකෝඩින් අපි මේ view කරන්නේ කොහොමද පාත් එක?
රෙකෝඩින් එක අප්ලෝඩ් කරාම ඔයගොල්ලන්ට ඒකේ මේ ලින්ක් එකක් අපි දානවා මේ ලර්නින් රිසෝසස් වල. ඒකට ක්ලික් කරාම ඔයගොල්ලන්ව ඩිරෙක්ට් වෙනවා ඒ Google Drive එකේ තියෙන වීඩියෝ මේකට.
right madam, thank you.
ලින්ක් එක තමයි ක්ලික් කරන්න ඕනේ ඔයගොල්ලෝ.
okay.
Okay, I will wind up these sessions. Okay.
thank you madam.